This segment of DelmarvaLife is brought to you by Delmarva Dental Services.
Well, whether we want to admit it or not, we all have bad habits. I break my fingernails. I don't bite them.
Right.
I just kind of break them off, and most of the time, I don't realize I'm doing it.
Yeah.
What about you, Jimmy? You got any bad habits there?
I'm kind of sorry you brought it up now. I got a bad habit of picking dead skin off my hands.
Ew!
I know. I hate it there, and I try to get it off. Anyway, breaking a bad habit is not an easy thing to do. Actually, there are some that suggest it takes 21 days, and depending on the habit, it might actually take many, many more.
Well, today we are talking habits that affect our mouths. Now, according to Dr. Leigh Auchey of Delmarva Dental Services, there are more than you might think, and many of them happen while you're at work. We know that sugary drinks are bad for your teeth.
Everybody knows soda's not great for me. That doesn't mean people don't drink soda, but it's also energy drinks. It can be coffees, it can be tea, alcohol even.
But Dr. Leigh Auchey of Delmarva Dental Services says how you drink them may be worse, specifically sipping through your workday.
There are a lot of jobs where people sip on sodas, coffee, maybe energy drinks, depending on what their job is, because they're either around it all the time. If you, for example, work in the food industry, you know, you're running around serving tables or cooking food, you're hot, maybe you don't reach for water, maybe you reach for soda instead. So the constant bathing of your teeth in that sugar, acid, soda, the carbonation, everything like that is just a recipe for cavities, especially when you don't give your mouth and the saliva a chance to flush it all away.
Work is also where we tend to grab a quick snack during a busy day.
Snack foods are great because they're easy. Snack foods are bad because they're usually higher in carbohydrate and sugar content. So, you know, those prepackaged little items that we have around when you have little children, super easy, grab it. When you're on the go, super easy, grab it. If you're a truck driver or, you know, somebody who's on the road a lot, maybe those are the easiest snacks for you to have because you can't stop all the time. But sugars obviously break down our teeth into decay. So do carbohydrates. Carbohydrates are a form of sugar. They break down towards sugars. And so people don't think cheese and crackers is a problem. Just because it's not sweet when you eat it doesn't mean that it can't be a problem for your teeth.
In a perfect world, Dr. Auchey says we would take time to brush between those snacks, but
we're busy at work, you know, running from school to games to practice to other things, and so we don't always have time to do that. So just making the right choices on the snacks are also better.
Even what's considered a quick fix to mask any bad breath caused by sipping on coffee or snacking, whether it's a mint or gum, can create cavities.
Unfortunately, if you're not choosing a sugar-free item, this can be a major source of tooth decay, even creating sensitivity and breakdown of the teeth as well.
Then there's stress.
We are all stressed in one way or another, whether you even realize it or not. And that can be stress at work, that can be stress at home, that can just be day to day. Some days it's worse than others.
Dr. Auchey says stress causes many people to tense their jaws, and that can lead to a chain reaction of problems.
And so you can have TMJ disorder issues, so you can have tight muscles, you can create headaches, but it also can result in tooth breakage, fracture, wearing down of your teeth such that your bite or your function is no longer adequate to chew foods properly.
She adds some people don't even realize they're doing it.
For example, if you ask them, oh, well, I did realize after you said so, but when I work at my computer, I grit my teeth together. Or when I'm exercising, I grit my teeth together because I'm working hard at something. So there are a lot of different forms of stress that can be placed on the teeth.
But your dentist can likely spot the signs.
Our teeth are made to bite together, to dissolve our food, that sort of thing. But when we see wear patterns on the teeth or a lot of crack lines in the teeth, we know that there's a parafunctional habit that is something that's occurring outside of the norm of what the teeth should be doing for us.
And of course, dangerous jobs can be hard on your teeth. Dr. Auchey says she's treated construction workers and machine operators who have had an accident that resulted in damage to their teeth or even their jaws.
Oh.
Things you don't even think about.
Things you don't even think about.